Good morning. Welcome and thanks for coming. My name is Rick Lindquist. I'm a bariatric physician with Swedish Weight Loss Services, partnered up with a bariatric surgeon, Ross McMahon. We're in the 8th floor of the Heath Building. And we are very, very happy to have the opportunity to have our speaker here today. As we know, overweight and obesity is epidemic, involved in an estimated 2/3 of Americans. I think those of us in this room who've struggled with our weight, and even those of us who haven't, we get that. Worldwide, the World Health Organization tells us that overweight and obesity has surpassed hunger and malnutrition in numbers, especially in developing countries such as India. Conventional wisdom that we largely were trained in this room has offered the advice to eat low-fat, push away from the table, and get more exercise. To channel Dr. Phil, how's that working for you? Large studies, such as the National Health and Nutrition Examination Study, or NHANES, have shown that we've succeeded in many ways. We've dropped fat. And yet we've seen the incidence of overweight and obesity and the myriad diseases that go along with it, we've seen them skyrocket over the years. In med school, we were taught that 50% of what we know is wrong, and we just don't know which half that is. As clinicians, we discover the cause of our own ignorance by continuing to learn and by asking the question, what am I missing? As scientists, we ask ourselves if we are really using the best science available, and we look for new information, not to reinforce what we think we know, but to find out what we don't know. Our speaker, Gary Taubes, is a nationally recognized questioner of conventional wisdom. He is an ongoing contributing correspondent for Science magazine with multiple national awards for science journalism. He brings to the table an undergraduate degree in physics, a master's degree in engineering, and a master's in journalism from such slacker schools as Harvard, Stanford, and Columbia universities. In 2007, he released a book called Good Calories, Bad Calories. And on the advice of a friend, I read this. And the first third particularly goes through conventional wisdom around the lipid hypothesis of obesity and heart disease, etc. All the studies that I was supposed to have read thoroughly in medical school. Like most physicians, after my epidemiologic classes, I read the introduction, the abstract, and I went to the discussion. But it's all the stuff in between that's key. As physicians, we're trained, and health practitioners, we're trained to implement. We're not primary researchers. We're not primarily scientists, although we can be. So it's my pleasure today to introduce a scientist who will take us through the story of Adiposity 101, why we get fat. Mr. Gary Taubes.
Thank you very much for having me. One quick question. My talk tends to run long. I'll try to keep within the time period, but we'll have time for questions also afterwards. I'm happy to stay late if you guys can. I'm not a scientist. I was a journalist with a father who could afford to send me to good colleges. I spent a lot of my youth writing about controversial science. I lived at a physics laboratory for a year and watched physicists discover non-existent elementary particles, and wrote a book about cold fusion, if you remember that. So I was trained by some very good scientists, basically how to think like a scientist and how to look for the holes in the data and what to question and what not to question. And about 15 years ago, I got into public health because some of my physics friends said, if you think the science in cold fusion is bad, you should look at public health. And been doing it ever since, and basically just following the trail of research where I had no idea where it would go, and it ended up with this, and now I'm trying to convince people that this has to be taken seriously. The lecture I'm going to give tonight, the book has a lot of information. It addresses a lot of different issues. This lecture is the one that I think is the most clearest cut. It's the one least open to application, to insinuations that I'm just cherry-picking the data. And you know, part of the reason I give the lectures, I want you to read the book because I want you to see, I don't want you to have to trust me on anything. And this is densely annotated. So in that sense, my conflict of interest is that I am selling a book. And I want you to read it. And better yet, I notice that there are not a lot, even though this is grand rounds, there do not seem to be a lot of working physicians, people in white coats in this room. And so if you find this compelling, you might tell your colleagues to read it or to watch this online. So first question I want to ask is just why are we getting fatter? You know, there's an obesity epidemic out there. I don't have to go through the details, but as you can see from the mid-1970s onward, the level of obesity in the United States turned upward. And it goes along with the diabetes epidemic. Diabetic diagnoses of diabetes in the U.S. has increased about threefold in the past 30 years. And the key thing is the burden of disease. Obesity is related. Here we go. Turn it around. Obesity is associated with an increased incidence of all these chronic diseases. Insulin resistance, well, you could put insulin resistance in the center and put obesity out here. Type 2 diabetes, fatty liver disease, atherosclerosis, hypertension, cancer. Your cancer risk goes up if you're obese, asthma, sleep apnea, osteoarthritis, neurodegeneration. We could put Alzheimer's in this list. So basically, if 2/3 of Americans are overweight or obese, a large share of all the patients you're going to see in this hospital have disorders that may be caused in large part by their weight problems, or at least exacerbated by their weight problems. And one thing we could say, and this is sort of my working philosophy, is that in a sense, because obesity increases the risk of all these diseases, whatever makes us fat makes us sick also. Okay? So just keep that in mind, because a possible causal link is that whatever the actual cause of obesity is, that is also the cause of all these chronic diseases that associate with it. So here's my outline, which I won't go into at the moment. So the question we want to ask is a simple one. Why do we get fat? Why do we get fat? The conventional wisdom is what's, technical term is the energy balance hypothesis. We eat too much. We take in more calories than we consume, and the excess is stored as fat. Phrase you hear often is calories in minus calories out. The difference is stored in our fat tissue. That's why we tell people to eat less and exercise more. If you look at the official websites, this is how you always find it. Overweight is a result of caloric imbalance, too few calories expended by the amount of calories consumed, and is mediated by genetics and health. Obesity occurs when a person consumes more calories from food than he or she burns. I don't know how many people in this room question this hypothesis, this idea, who haven't read my book. But what I'm going to try and convince you is not only is it wrong, it's actually nonsense. And it is the reason why there's an obesity and diabetes epidemic today, is because we came to believe that this nonsense is somehow dogma, somehow something that cannot be questioned. And because we were talking about the obesity epidemic, and we're going to proceed in a kind of scientific manner, we want to be able to explain the obesity epidemic. And so the way it's done today, using this energy balance hypothesis, is to blame it on improved prosperity. Marion Nestle, an NYU nutritionist in Science, she said people use extra income to eat more and be less. Kelly Brownell coined this phrase, toxic environment, that encourages overeating and physical inactivity. Another phrase you now see in the science, in the literature, is an obesogenic environment. And this is how Kelly described it, and it's as good a description as any. He said cheeseburgers and French fries, drive-in windows and supersizes, soft drinks and candy, potato chips, cheese curls, once unusual as are much part of our background as trees, grass, and clouds. Few children walk or bike to school. There's little physical education. Computers, video games, televisions keep children inside and inactive. Parents are reluctant to let children roam free to play. So the obvious question is, just from a scientific perspective, this seems like it's unquestionable. It's a hypothesis, and we want to know, can the hypothesis explain the observations? So let's look at some of the observations we want to explain. This young lady is a Pima Indian named Fat Louisa. That's how she was called by Frank Russell, a Harvard anthropologist, in 1902. And interesting thing about the Pima Indians, today they're considered the poster children for obesity and diabetics in the U.S. They live on land south of Phoenix, Arizona. They have the largest diabetes incident, the highest diabetes rates in the country. Well, little-known fact is, in 1846, in the mid-19th century, the Pima were the most affluent Native American tribe. They hunted in the nearby mountains. They fished and got clams from the Gila River. They were agriculturalists also. They raised wheat and corn. They had pigs and cattle. In 1846, when a U.S. battalion went through the Pima territory, the battalion surgeon described all the Pima as sprightly and fine health, said they had the greatest abundance of food and take care of it well. They had so much food, the Pima, that in 1849, after gold was discovered in California, the Pima lie on their territory lie in the Santa